It's your health, and experts say it is already time to start thinking about getting your flu shot. Add in the coronavirus pandemic, and it's a cause for concern. Dr. Mike Muziowski, emergency room physician with HCA Midwest Health, is here to tell us what you can do to stay healthy. So, doctor, when you combine the flu, the COVID-19 pandemic, and other viruses circulating, what do you suggest that people do to protect themselves during this time?
This winter, with the flu season upon us, it's going to be a tough season. We still have the COVID virus, and then if you add flu and other viruses such as RSV on top of that, it definitely clouds the picture, from a medical perspective. The number one thing you can do is to get a vaccine. Typically, we offer flu shots, and tell people to get them by the end of October.
And what makes this season, flu season that is, tough?
Well, it's tough because, last year the flu was basically non-existent. Well, this year, the school's back in, kids are around, people are going back to work, and everybody is just, going to those social gatherings. And because of that, we are going to see an increased amount of flu, RSV, and potentially COVID. So it's going to be tough. You're going to have all three of those viruses and more that are going to kind of cloud the picture when someone gets sick.
Now, you already said vaccines are important, but what can people do to stay healthy other than getting vaccinated?
Make sure you wash your hands multiple times throughout the day. If you are out in public, make sure that you wear a mask. Make sure that when you touch doorknobs, shopping carts, anything that other people will put their hands on, that you're using hand sanitizer. And then if you are sick, make sure that you stay home. You don't expose those other people.
And you talked about some symptoms already. What are flu symptoms that people should watch out for? And when do you know, okay, now I need to go to a doctor?
So the flu causes fever. Typically that's above 100 degrees, though you don't have to have a fever. Headaches, cough, congestion, body aches can cause shortness of breath. And so those are the things that you want to look out for. Now, of course, those things I just said, they do also sound like the COVID virus. So typically with COVID, you'll have the loss of taste and smell. And so that's really how you kind of distinguish between the two, but it can be very difficult. If you do get sick, not everybody needs to run and go to a doctor, that's for sure. But if you are experiencing shortness of breath or chest pain, or you feel like you're dehydrated and you feel like you're extremely weak, then you should reach out to a medical professional.
All right, thank you, doctor. Those are some good tips, especially for this time of year. For more stories just like this one, head over to our website, kctv5.com/HCA Midwest.